Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the task force public information contacts, and we will attempt to address them during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody, and thank you for joining us here this afternoon. First, I wanted to share some really exciting and important news, and that is, as of today, we have discharged 1,034 COVID-19 patients from our area hospitals to home. Now, that is really tremendous news and a direct reflection of the outstanding work and heroic commitment of thousands of healthcare workers in the region. And it's also the result of our collective efforts of essential workers who have kept our community moving, small business owners who have sacrificed a great deal, and elected officials who had to make some very tough decisions. All of you play a part in helping our community get to this really important milestone and for saving lives. So let's review where we stand today. So as of today, we have 701 hospitalizations, which is slightly up from yesterday, where we had 694. And remember, we're still way up from the totals from when we started these briefings in early April. There are 168 intensive care unit patients today, which is slightly down compared to 170 yesterday. And we have 114 patients on ventilators, which is down compared to 123 that we had yesterday. And in continuing the good news, we had another 37 COVID patients that were discharged yesterday, and that brought us over that 1,000 mark that I mentioned earlier. So we're making some really important progress, and I want to talk for a minute about how we as a community have done that. And it's based on science and math. So this is some best guesses on the impact of the different policies and the different practices that we have made and how it's impacted the spread of the disease. And it's based off of the same people that have done the hammer and the dance slide that I've shown you before. With any contagious and dangerous virus like this coronavirus, you have to stop or slow the spread from person to person, and that's called the reproduction factor. You want to keep that factor, or what's called the R0, less than 1, and that means each infected person is infecting less than one person, which sounds odd, but really it's how many people can an infected person go on to infect. And so if it's less than 1, then they're not infecting anybody else. So keeping it less than 1 is really important. So there are many ways that you can decrease that reproductive factor. And some of those are listed here to my left, are now very familiar to us in the region. And they include everything from hand washing to closing facilities. And all of those steps help to reduce the reproductive factor of the virus. So as you'll see in a second, this has been done very successfully so far in the St. Louis region. Even though there's still hundreds of people that are sick, had we not taken these measures that we did, there would be many, many more, and we would be having a different conversation today. So let me show you how this works out compared to our numbers. So remember, you want to have that reproduction factor of less than 1. When we first started noticing infections in this region, we estimated that the reproductive factor was probably around 5. So that means that people were going about their normal business, they were going to businesses, getting together in large groups, things like that. And so the ability for the virus to transmit was pretty high. And so we estimated that as around 5. Now, when the stay-at-home orders went into place in the region in the full 3rd week of March, we believe that that reproductive factor dropped to around 2. And there's reasons for that. So some of those things with increased hand washing, social distancing, all of those things play a role in reducing that reproductive factor. But because of the work of everybody in the region that's been doing to stay at home, wash your hands, practice social distancing, all of those things have now added up. And we believe that the reproductive factor is now less than 1. And that's tremendous progress and allows us to keep the virus in check if it continues. Now, if that reproduction rate then spikes, meaning it goes above 1, which means we've increased transmission in the community, we'll see more people getting infected, more people getting sick, and eventually we'll see more people dying. So we want to do all that we can to keep that reproductive number low, less than 1. That's how transmission stops. That's how pandemics end, is either through no more transmission or vaccine. And so as we consider how we move into a stabilization and a recovery process, we have to know how we can keep that rate as low as possible. And I do want to assure people that stabilization and recovery is going to be coming, but we have to be patient and we have to be very deliberate on how we go about doing that. And so now, be happy to take any questions from the media.
Dr. Garza, you have stated that this weekend will be the peak of cases in St. Louis. Many communities adjacent to St. Louis are wanting to open their businesses this weekend during what is the most sensitive time, potentially. How will this impact future projections, and could reopening businesses too quickly create another larger curve downstream?
Couple of questions embedded in there. So if you think about anything that increases the risk of transmission, that will eventually lead to more cases and more hospitalizations. So we have said that the peak in our model is going to be coming this weekend. So that means we'll be seeing the most amount of patients within our facilities, we believe, by this weekend. We're still not on the downward side of the slope. So in order for us to feel comfortable that we've decreased transmission enough so that we can start relaxing social distancing rules, things like that, we want to see a sustained reduction in those numbers of hospitalizations. And the reason for that is our really best marker of the transmission going on in the community. Absent wide-scale testing, that is our best marker for what is occurring out in the community. So anything that we can do to keep transmission low until we can see those numbers coming down is what we should be doing.
As a follow-up to that question, Dr. Garza, for folks who become sick in some of those adjacent communities, would they potentially end up in St. Louis area hospitals?
Well, I believe yes. If you think about the major healthcare systems that are involved in the pandemic task force, they represent the largest market share of any of the hospitals in the region. And so it's high probability that they will end up in one of our facilities if they become sick and then hospitalized.
If Governor Parson outlines plans for reopening the state in the short term, what are your thoughts on safely doing that over the next week, 2 weeks, 3 weeks, etc.?
A couple of answers to that. So one is, as I stated earlier, we want to see sustained decrease in our number of hospitalizations. That gives us confidence that transmission is low in the community. And so we would want to see that. The second piece to that is, how do you responsibly then begin to recover the economy? And that is then thinking about, for individual industries, for individual businesses, how can we adjust the way that they do business to decrease the risk of transmission? And so I'll give you a really simple example. So let's say that we wanted to open up the restaurant business. Should we open up the restaurant business for business as usual? That means crowded rooms where people are waiting for tables, crowded bar spaces, and crowded restaurants with a lot of people intermingling with each other. And I think most people would agree that the answer to that is no. So how can we then allow a restaurant to open up under sort of a new guidelines? So maybe that is, we space tables 10 feet apart. Maybe that is all of the wait staff have to wear face masks. Maybe that is no waiting in those waiting areas for a table. And maybe that is everybody has to, use some sort of like Purell when they enter the facility, when they leave the facility, like they do on cruise ships to reduce infection. And so it's thinking through those number of conditions that we need to give to businesses to allow them to safely then reopen their businesses.
Is it prudent to allow counties to start lifting restrictions on businesses or movement right away?
Yeah, again, I would go back to, I would have to feel confident that the rate of spread is low in the community. And as you can see from our numbers, we're not there yet. So in order for us to feel that it is prudent to then start recovering businesses, start opening up different aspects of the economy where we know we're going to be increasing the risk of transmission, one of the first steps is feeling confident that we've gotten the transmission rate as low as we can. And that's through tracking data.
Similar to one of the prior questions, but when at this point does it seem like it's the right time for state government to start allowing people or businesses to go back to old routines?
It depends on what you mean by old routines. So if old routines is going back to where we were pre-pandemic, then I would say we're quite a ways away from there. We may never get there until we get vaccine. And so we have to think about how are we going to be positioning ourselves to best move forward in the future to limit transmission. Just because the rate of transmission is declining doesn't mean the virus has gone away. And there's still groups of people, there's still large parts of the population that are still vulnerable to the virus. So the virus will continue to spread. The goal is to keep it as low as possible. And so we have to be thinking in terms of how do we keep the spread as low as possible while balancing that with opening up the economy and the different businesses.
This reporter writes that she's heard from several people that patients are holding off visiting emergency rooms because they're worried about contracting the virus or may have been told to stay home to decrease strain on hospitals. Has volume in emergency rooms gone down across the task force health systems during the coronavirus pandemic?
That's an interesting question, and it is a phenomena that we're seeing, not just here in St. Louis, but really across the country where emergency department volumes have dropped. And so I think the reporter is right. So there's a couple of explanations, a couple of theories about this. So one is I do believe that people are concerned about coming to the emergency department with their complaints because of fear that they'll be exposed to coronavirus. So let me address that really quickly. The way that we've addressed this in our emergency departments is to segment off pieces of the emergency department that are strictly for respiratory complaints and fevers and things like that. And then other parts of the emergency department are for all of those other complaints that aren't fever, cough, all of those other things. And so we do believe it is perfectly safe to come to the emergency department with any of those complaints. The second piece of that is there's probably a drop off from a lot of sort of non-emergent complaints. So people, you've heard us say in the past where people come to the emergency department with really non-emergency problems, and people are making the calculation now that they don't want to come to the emergency department, again, because of a potential risk for exposure or at least a thought that they might be potentially exposed. And so those non-emergent problems are probably not coming to the emergency department as well. But yes, we have noticed that drop in volume, and those are, I think, some of the reasons why.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.